Hey, thanks for making it to Veterans Info Tap. I'm glad you made it. The VA Secretary, I believe, is going to draw the line somewhere in the sand and say this is as far as we can move the needle on anything regarding cuts or changes or what have you. I believe that he will draw a line at some point. This article that I found that we're going to jump into here is from WFYI in Indianapolis, and it's on their website. Came out May 29th, 2025. Sharing it with you here today. The headline is Veterans Affairs Secretary insists cuts to agency won't affect care for veterans. He has, I don't know what the number is now. He has continuously pushed that message, and he really hasn't ever changed his tune on that. Although we still haven't realized the full proposed cuts. The VA Secretary, Doug Collins, will throw out that it is a goal, not a hard line. And I think that with that messaging, there will be a line somewhere that is drawn. I don't know where that is. I don't work for the VA. So we will figure it out together. But let's read through this article. Hit the thumbs up for me. Subscribe if you haven't. Hit the thumbs up. I'm jumbling up. I don't know what I've already said. Thank you for your support. We'll just end that. All right. Moving on. U.S. Department of Veterans Affairs Secretary Doug Collins said change is coming to the VA, but insists patient care won't be compromised. And look, it really depends on where you have been, what you've experienced with the VA. Some people have great stories, some people have horror stories. So, let's go on and see what is going on here. Collins visited the, Roadbush Veterans Affairs Medical Center in Indianapolis on Thursday. Collins said the goal the Trump administration laid out was a 15% cut to the VA. Prompted, he said, by years of spending that didn't deliver adequate results. Our wait times were still up, our backlogs were up, Collins said. It's time to ask new questions. And to be honest with you, I kind of agree with that. Look, if you're dumping money and people and all this stuff and it's like it's still the same, maybe we need to approach it differently and figure that out. So let's move on. But veterans groups have voiced fears. I agree. Nobody likes change. It's scary. So veterans groups have voiced fears about how the cuts will impact care. Collins said frontline healthcare staff and benefits advisors will not be part of any cuts. We have duplicative HR systems. We have duplicative payroll systems. We have duplicative contracting systems, none of which affect the actual care, Collins said. Collins said the agency will look at modernizing the Indianapolis Medical Center, but he notes many VA hospitals are aging and addressing that is a budget issue Congress must confront. Look, I agree. In your area, how old is your VA facility? How old is your clinic, your VA clinic? How old is your vet center building? How old is your VA medical facility? A lot of these places are decades and decades and decades old. And that's just viewing it from the outside. Imagine the internal workings of these places. I've heard of certain clinics or hospitals that have been cordoned off because they are just so inadequate. Now, what I believe is happening, and this is just taking some of the messaging from the Secretary, Doug Collins, when he refers to veteran care in a medical way, in a healthcare way, he incorporates community care with VA healthcare as one, right? In a way, it kind of is, right? It's all paid for through the VA, coordinated, in fact, with the VA. I actually just got a call from my medical center's community care team to help schedule a community care appointment. So it is all essentially underneath the VA umbrella. And although you would be receiving care from the outside the VA community care provider, it's being facilitated essentially by the VA. So when he does that, and that's the type of messaging that he has, I envision, along with all the efforts to allow community care to be accessed easier, removing that second layer of bureaucracy to get approved VA community care. All of these things are pointing to really enabling the VA to allow veterans to utilize community care. So even if there's a little bit of a contrast on the healthcare VA side of the house, they're going to fill those gaps with the community care aspects, I believe. Now, am I a fan of moving completely to private, just community care and just get rid of VA healthcare? No, I think that there's an in-between. I think that in the bigger geographic areas, the more veteran populated areas, you're going to be able to facilitate VA healthcare facilities much easier than the small clinics that are out in the middle of nowhere, where maybe there was more of a veteran population, but over time maybe it starts decreasing. Every year, just like with military bases, military on the DoD side will do BRACs, right? The base realignment and closure process. Essentially, the VA does that with an AIR. It's an AIR, Asset Infrastructure Review. And they look at all of the ways that the VA is working with patients, where the patients are, where veterans are registered and going to get care. And we are a migrating population. Look at California, for example. California was the highest veteran populated state. Plenty of VA medical centers and facilities there. But California has slipped into second place for veteran population numbers. Veterans are not dying faster in California. They're moving from California to other veteran populated states or more friendly veteran states, maybe more benefits at the state level. So the numbers suggest that in the coming year or two, California could potentially slip to number 3 behind Texas and Florida in population. Well, what does that do to the VA medical facilities there? You're losing clients, right? They're leaving. They're not going to fly back there to get care. So all of these things need to be taken into consideration. And that's just one example of how we move. When we move, our care doesn't move with us. It stays there. Well, then nobody's going there. So then they have to close it down or shrink it up. So anyway, thanks for watching. I appreciate you very much. Have a great one. And remember, if we don't take care of each other, something went wrong.